Drugmakers BioNTech and Pfizer say 3 shots of their coronavirus vaccine are effective against the newly discovered Omicron variant. BioNTech also announced they could have a new Omicron-specific vaccine ready by March next year. Earlier, the World Health Organization said there is no reason to expect that the existing vaccines against the coronavirus will fail against the Omicron variant. Let's take a listen exactly to what the WHO's emergencies director said moments ago.
I would expect, quite frankly, that the vaccines we currently have will show efficacy against severe disease and hospitalization, but we have to measure that and we have to confirm that that's the case.
All right, I'd like to welcome now to DW News a molecular biologist, Ulrich Elling. He is with the Austrian Academy of Sciences in Vienna. A good day, sir. Encouraging news there from the WHO and BioNTech. Do we know just how well vaccines protect against this latest variant?
I think we have to separate different aspects here. One is when we think of the pandemic and how to manage it, it's all about whether it protects against infections. And the data that we got from a lot of scientists that work day and night on this today are lab data. So they deal with how well this can be neutralized, but it really doesn't answer us whether it protects against infection. Overall, it looks like infection will not be prevented by vaccination. There's enough of these case reports coming in now. We see increasing numbers all over the place. But indeed, it looks like vaccination might help against severe disease. And there, it's really a question of whether the glass is half empty or half full. Mm-hmm. So BioNTech and Moderna are pointing out that indeed 3 vaccinations, the booster, works much better than 2. But they still work, but in many cases, 2 vaccinations just don't work, as, for example, Sandra Zizek showed today.
Now, vaccine maker BioNTech say they are developing Omicron-specific boosters. Will vaccines have to be altered every time that there is a new variant on the scene? And was this an expected development?
Well, there was quite a bit of criticism, actually, that they did not already adapt their vaccines to Delta. And we now see that, in fact, it might have been premature to take that decision because it takes months. And now we have a variant where we probably will have to adopt it. We cannot adopt the booster to every new variant. But if there is a major change like the one we see now, then for sure this will be required because we really see massive drop in immunity.
Very briefly, if you can, there is still a lot that we have to figure out about this new variant. As a researcher yourself, how do you go about filling in the gaps? What do we know about Omicron?
The pandemic already has generated such a speed and the need for data that researchers have mostly moved from publishing peer-reviewed papers to publishing so-called preprints, so non-peer-reviewed papers that they put up in the open and that can be looked at. But now with Omicron, we actually see a move away from the preprints to Twitter even, such that researchers directly in live share their data straight out of the lab. And we are all trying to keep track of what's going on and trying to provide data as soon as possible. This is an urgent need now. And it really has to be said that the researchers that managed to provide data now within just a few days, really, since Omicron was identified, that is light speed and really impressive. So kudos to those people.
Kudos to those people. Brave new world. Molecular biologist Ulrich Elling is with the Austrian Academy of Sciences. He's been speaking to us from Vienna. Sir, thank you very much.
You're welcome.